Hello everyone, this is instructor Muriel Howard doing BC3030 week 3 breaking down coding cases. This week we will be covering reproductive and urinary coding and guidelines. So here's a few things that I want to point out, some hints before we move on to our coding. I want to assure that you guys have registered for the Evolve website. Be sure to register so that you can access and download helpful tools for coding because it's free. Pay attention to this announcement on the announcements page and also click this link and follow these instructions so that you can get access to valuable information that coincides with your textbook. Okay, so here's a quick review and see what's coming up next week. Be sure to always check your student materials folder weekly and or daily for videos, PowerPoints, assignments, and instructions. If you are having trouble with the previous week, always go back to the previous week's student materials information and review the videos and the instructions for the week. And if you're still having problems, reach out to me and I will set up some time to tutor you or go over just some specific questions that you may have. So next week, weeks 4 and 5, you will be taking a CPC mock exam. For week 4, you will be covering 75 questions. I believe you will be given 2 hours and 30 minutes to complete that particular test. It is not a heavily weighted test, but it gives you some insight into how the actual certification exam is formulated and the type of questions you will be going over. I will provide some review material. However, the material that I provide, it is not guaranteed that that particular question or sets of questions will be found and covered on your test. So make sure that you use what I send out to you and practice, continue to practice, and I will be uploading information for week 4 as early as this upcoming weekend so that you guys can get a head start and download what you can and ask any other questions before you attempt your test. And then for week 5, we have a 150 question CPC certification mock exam. And of course, both of these tests are graded, but they're not weighed heavily in the grade book. This is to prepare you to become a graduate and to move on to become certified. So that particular test is going to be 5 hours and 30 minutes. So I want to give you guys a heads up on that. Make sure that you are prepared, have had a good night's sleep, watch the videos and review the tools that I send out. Make sure that you attend one or more coaching labs or tutoring labs before you attempt to sit for that particular, either of those particular exams. And there are some very effective tutoring and training labs that are designed to cover the week 4 and 5 mock exam. So look at your calendar, which I send the link every week, the training and tutorial calendar for MBC. And there that could be located, or the link to that can be located inside of student toolkits and also inside of your announcements page and also inside of the weekly materials folder. Okay, so now that I've covered all of that, we can begin to code. Okay, so I will be covering 2 cases this week, for the one for the reproductive system and the other one for the urinary system. Once again, my number 1 and number 2 may not be the exact same cases on your test. This is just a synopsis and to teach you how to abstract and what to do if perhaps you have a similar case like this, or if you just are coding for this system, you know what the important factors are that you need when abstracting. Excuse me. Okay, so I'm going to begin. This is an operative note, and I have once again my first three columns or my first three headings of information. The first one that I highlight is the prostate cancer for postoperative. Preoperative and postoperative are the same. The procedure is the next thing that I highlight. The patient had ultrasound guidance for placement of gold fiducial markers. Okay, so the first thing I am going to do, well, the next thing, I highlighted a good percentage of my case, and then I pulled out or abstracted how I'm going to locate my ICD-9 first. We have volume 2, and we will go to the neoplasm table, and then we'll go to the word prostate because that's where the neoplasm is located, and we're going to code this as primary. And the reason we're going to code this as primary is because we do not have any indications in our notes that this is a secondary occurrence of his cancer in a different location than before. So since that's the case, we code this as primary neoplasm of the prostate. And I always reference, and I have volume 1 listed here, always reference your code to the numerical index in volume 1 just so that you can have any additional facts or any additional information that you need. Sometimes it refers you to another code, or sometimes it tells you that you can code an additional diagnosis. So just be in a habit of always cross-referencing, even if you are using the tables like the neoplasm table, drugs and chemical table, hypertension table, always reference back to volume 1. Okay, so for the procedure portion, I have that the patient is going to get placement of gold fiducial markers, and there is an ultrasound guidance done for that. So what is going on with this patient is that they are going to do some radiation therapy, the oncology department, to his prostate to help reduce the size of the tumor. And when that happens, it's going to be done where it's non-surgical. It's like in a diagnostic setting. So the provider is asked to place these gold markers near or on the actual tumors so that the oncologist, through radiation therapy, can locate the tumors easily, and the markers allow that area to illuminate so that they can focus in the right area. So that's what fiducial markers are for. I always say Google these terms that you don't understand or these procedures and get a better idea of what's happening to the patient, and that makes it much easier to code. Okay, so this is done in the hospital because it says the hospital ultrasound department assisted me in imaging. That's important, but I'm going to come back to that. So what did the patient have done? It appears that he had an ultrasound. However, the provider did placement, and I'm going to highlight this word. I'm going to turn it red. So how do we locate this code? Initially, we go to the word placement. That's the action word. When you're dealing with the procedures, you always want to look at the action word. What is actually being done? What is the word that's showing a process of something being done to a body part? And that's how you know what your search term is going to be, or your initial search term is going to be, and that's a good start. It's not always how you locate your CPT codes or main terms, but I want to say 95% of the time, that action word in that procedure sentence, not this description, just the sentence right here, will give you exactly where you need to be. So the first thing is placement. The second thing is placement of what? This word, fiducial. And it may be spelled a little funny, but I think you would locate it under like this, or it may be, depending on the volume of book that you have. I mean, I'm sorry, the year. I want to say volume. I want to say the year. And then, of course, it's fiducial markers. And then where are the markers being placed? They're being placed on the prostate. Then it gives you a reference code, and you always going to cross-reference. So whatever code you find here, cross-reference it and look at the code description. Make sure it matches 100%. And you're going to probably get a parenthetical note explaining that if there was ultrasound guidance, that you will need to report an additional code for that. But the reason, and this brings me back to here, the reason I highlighted the hospital ultrasound department assisted in the imaging is because the provider is only doing a portion of the service. He's not even actually doing the ultrasound guidance. So the equipment, the imaging, the guidance, all of that is going to be billed by the hospital. And so the provider will only bill for placement of the fiducial markers. And then the hospital will bill for the ultrasound imaging guidance for the same data service for the same patient. And they will not need to use a TC modifier because they're providing the full service. So that's why it's important to understand the rules related to inpatient, outpatient, how the provider bills for radiologic or diagnostic testing in either setting. So the next case we're going to cover, where is it, is quite similar to that. And let me pull this up just a little bit. Similar but different. Okay, so this one is for a pregnancy or amniocentesis for a pregnant uterus. And here are the indications, which is another good place to locate valuable information. So it's telling us that this patient, is 28 years old, and they have G4, which means gravida, and in medical terminology, G4 or gravida stands for pregnancies. So she had 4 pregnancies. The P, para, is 2, which basically means she has 2 live births or 2 births out of the 4 pregnancies. And at this point, she is 36 weeks and 2 days out of 7. So doing more cases and reviewing more notes relative to a specific specialty will give you a lot more insight into all of these abbreviations. However, you have a ton of abbreviations in all of your textbooks. In the back, your appendices. You should be able to locate a lot of helpful information to help you pull out terms. So she's here today for an amniocentesis. I'm going to highlight that. And it has FLM, and this is for the fetal lung maturity. So they do this test to determine if the lungs have developed enough for the child to be born. And then what her secondary issue, because they're determining if there's a risk. And for women who have given birth before, this term or this information may be a little familiar. let me go back. I put that in the wrong spot. This is for RH isoimmunization to the D antigen or her RHD factor. So when there's a D antigen with the child, the mother may be negative. So if she's RH negative and the child is RH positive that has the D antigen in their blood, then it could cause a problem with the mother. So this is like, you're giving birth to a child, but it's dangerous because you're allergic or you um, are not immune to the antigen that your child is producing inside of your body, and you're sharing blood through the umbilical cord. So in some instances, they have to give birth or have the woman give birth to the child early so that she's not at risk. But right now, her pregnancy is considered high risk. So that's some additional information here. And I know that some of you are probably very familiar with that because there's a lot of people who's RH negative and RH positive and so forth. Okay, so what they did here um, is that they did an ultrasound. Here's the procedure. I'm going to highlight that. And they can see that she is pregnant. And they gauged everything. But I wanted to see where it shows in here that this was done in the office. Well, basically, this is telling us, or it should tell us clearly, and it doesn't tell us clearly, but I'm letting you guys know that the patient was seen in the office, in the doctor's office. So, with this particular ultrasound procedure, the provider will be billing for 2 codes, and that's why I wanted to see where it says hospital. It doesn't say hospital. Alright, so what we do, we simply just go to the word amniocentesis for the CPT. I'm starting with CPT first. I know last time I did diagnosis. And that's our first search term. And then once we go to the word amniocentesis in the CPT index, we're just referred to our reference code for amniocentesis. Now we know that amniocentesis is a pregnancy procedure, so we're going to end up in the 5s dealing with pregnancy surgical procedures. And when we get there, whatever our reference code is, we have to read. Of course, we double check the code, and if the code is accurate, we're going to read parentheses. The parenthetical notes is what they're called. The parentheses gives you an additional code to report for the radiologic service and interpretation. So you're going to be referenced to the proper code for the radiology portion if you choose the correct code for the amniocentesis. And from there, we code both procedures as is. We do not need a professional 26 modifier in this instance because the provider is rendering the service in her office. I'm sorry, in his office. I don't know if it's a he or a she. And there's no assistance being done like here. So this particular procedure, we cannot code and bill for the ultrasound or the radiology guidance or ultrasound guidance because we are inpatient. Hospital has that. This one we can, and we don't need a modifier because we're billing it as a global or a component code. Is global service. And for the ICD-9, and I don't have my line for ICD-9. For ICD-9, we see that the woman is basically pregnant, and the woman, let me see, she has, I want to say, I'm looking for the correct term. Well, we can go to pregnancy. And let me just type this out. I believe the term is supervision, and I don't have my book open. Let me do one here, and then underneath that it would be supervision 4, and 3 is high risk. I was going to say pregnancy high risk, but I know that there's another term in between. And then high risk, and underneath high risk, all these indentions, she has a specified problem. The specified problem is because of her RH immunization. Okay, and then the next ICD-9, we're going to have 2 codes here. And let me come up. Let me bring my page down a little bit because I want you guys to see how I do this. We also have pregnancy, and number 2 is a complicated. That's what I call it. I called it high risk, but it's described in the ICD-9 as complicated. And that's it. So she's RH immune, or immunization issues during her pregnancy. So her pregnancy has been complicated, or complicated pregnancy. Um, and that should give you all of your codes for this procedure and diagnosis for this case or a similar case. And if you have any questions about this, or if something doesn't make sense, or if I fumbled my words too much, then please reach out to me by way of email, text, or schedule a starfish appointment with me. Thank you for viewing. Here's my cell phone number. You can call or text me almost 7 days a week. I'm usually always near my phone. Thank you for watching.